excited to reintroduce Dr. Melissa Deimling, who did one of our previous sessions from Community Care Pediatrics Latham, located at 6 Wellness Way off Route 9 in Latham. Dr. Deimling is a board-certified pediatrician, and she received her BS in neuroscience from the University of Rochester and her medical degree from Stony Brook. She then completed a pediatric residency at Duke University Medical Center, where she served as chief resident. She was on the faculty at the Duke Department of Pediatrics, where she practiced and taught for 8 years before returning to the Capital Region in 2016 and joining CCP. Dr. Deimling is a fellow of the American Academy of Pediatrics, which really speaks to the standard of excellence she maintains for her patients. So thank you, Dr. Deimling, for educating all of us today. I will now turn it over to you to get us started tonight. Thank you.
Thank you, Alexis. I appreciate that. Very generous introduction and welcome to everyone. I'm so glad that you all could join me today. I am excited to learn with you together. I did go ahead and advance to the next slide. Before we start any learning, I've got to brag about our group. I am one of 9 providers at Community Care Pediatrics, Latham. We also go by Latham Pediatrics or Latham Peds. We are very excited and proud to welcome patients to our new Wellness Way location. We've been open there since spring of 2024. We are easy to find off any of the major highways, and we're open 6 out of 7 days a week. We know that kids decide to get sick whenever they're going to get sick. So we are open every day but Sunday, and that includes most holidays except for Christmas and Thanksgiving. So we have quite a lot of availability. We see regular checkups on a regular basis. We also see sick visits all of those days and are available to you once you are home from the hospital. And we'll certainly talk about that process through this presentation. We are made up of 9 total providers. There's 6 physicians. There are 3 pediatric nurse practitioners. We are an all-female team. We are an all-mom team. So we are a powerful, force to be there to help you with whatever you need, both from our medical and professional experience, but also from our experience as moms. One of the things I love about Wellness Way is that it's a one-stop shop. So our office is right off the main, when you come right in the main entrance, easy to find, even if you're loaded down with diaper bags and strollers. But within our building, actually right next to our suite, we've got everything else you could need. We've got the lab is right next door. Right next to that is the pharmacy. We've got X-ray down the hallway. We have a cafe down the hallway. So everything is there for you in one place. So you don't feel like you have to drive around the Capital Region to get your medical care needs met, which is fantastic. We are always available 24/7. That includes 7 days a week. That includes holidays. One of us is always on call. I happen to be on call right now, so I hope I don't get any calls during this presentation, but we are always available. No question is silly. If you need us, you call. Next slide, please. The other plug I have to throw out there besides our fantastic office is this series. We've already done parts 1 and 2 out of 5. I did part 1, which talks through what to expect in the hospital. And my colleague, Dr. Latin Ailey, did a absolutely fantastic talk about infant sleep. So please do check those out. Those are on our website under our news tab. They're pinned to the top of our Facebook page. And I think they're definitely worth a watch and a listen. Next slide. Here's our plan. So we're going to talk about the basics, things babies are pretty much doing nonstop, which is feeding and sleeping. There will be peeing and pooping in there, of course, in addition. We're going to go through some safety things, and then we're going to talk about weird stuff you may encounter. I will say that Dr. O'Connor is going to be doing what sounds like will be a wonderful talk in a few weeks about sort of expanding on some of that weird stuff, especially the stuff that we are worried about. So I do encourage you to check in there, but we will go over some things briefly. Next slide. Let's talk feeding. They do a lot of this. Feeding feels like it's 24/7, and it is. Newborn babies feed about every 1 to 3 hours around the clock. They do not care that it's day or night, and they don't care that you're tired. So it can feel really incessant. We expect newborns to lose up to about 10% of their birth weight, and it can take 1 to 2 weeks, sometimes even longer, to get back to that birth weight. So that's one of the reasons why they just feed so frequently. They know they've lost that weight and they're trying to get back up to it. It can feel like Groundhog's Day. They're sleeping, they wake up, they eat, they pee, they poop, they go back to sleep over and over and over again. What we went through in part one, but which I'll also go through today, obviously, is that the two ways to feed your baby are breastfeeding and bottle feeding. And bottle feeding can be either formula or pumped milk or a combination of all of those things. Breastfeeding is, I think there can be a misperception that everyone who breastfeeds has an easy time of it. And I would say in my experience as a breastfeeding mom, and as a pediatrician for a while now, it's often not that easy, especially at the beginning. It's worth the effort, has a lot of benefits, but there can be challenges. What I do recommend when you breastfeed is to breastfeed, try for both sides. So babies often will try one breast, they may get sleepy. You want to try and keep them awake to feed from the other side as well. Kind of like, instead of leaving half the plate, eat your whole plate, that kind of thing. And that may give you some time in between feeds where baby's a little bit more satiated. There can be issues with the latch. It takes practice. There's different positions you want to try, and it can be painful at first. I equate it to wearing a brand new set of like 5-inch heels incessantly and walking all over the place. You're going to have some sore feet. You're going to have some blisters. It's kind of like that because your breasts are just not used to any of that. So you can get, besides pain, your nipples can have some cracking and bleeding, and there's an incredible assortment of products that you can use to help get through those initial challenges. Pumping is another option. There's not a right answer to when you should or should not start pumping. Babies who have lost a lot of weight at first, moms who are awaiting their milk to come in, which, by the way, even normally can take about 3 to 5 days to come in, pumping can help push that process along and may be recommended by your pediatrician. After latch is well established, and that could be a week or two or a few weeks after that, pumping is a fine thing to start, especially for parents who are planning to go back to work or who are deciding to use pumped milk for example, mom to be able to rest. And obviously, if parents are choosing to do mainly or exclusively pumped milk, you can start pumping right away. And the the birthing hospital will have those pumps accessible to you as well. I do encourage parents to meet with lactation in the birthing hospital if you think there's even a chance you're going to want to breastfeed. If you're on the fence, I would still meet with them after baby is born just to get some tips and some ideas and to get that great list of resources that they have. Most of the birthing hospitals will work with parents after they're discharged home with their new baby, but there are also community groups. Some of those groups, working with them is covered by your medical insurance. Some of them are pay out of pocket. There are also parent groups through the birthing hospital that are like support groups, which I think are fantastic. I know Bellevue has a great one that I hear really great feedback about. This is like a group of parents who come together on, let's say, a weekly basis. The session is usually run by like a lactation consultant or a pediatric nurse or a combination. And it's like kind of a little bit of support, a little bit of hangout, a little bit of breastfeeding help. It's really, I get great feedback about those sessions. So just consider that. For bottle feeding, whether that be formula feeding or pumped milk feeding, I would want you to anticipate that, again, babies are going to feed about every 1 to 3 hours around the clock, and it's usually between 1 and 3 ounces on demand. At first, until babies go back to birth weight, we're going to want you to wake the baby up at least every 3 hours. Babies are pretty sleepy at first, which we'll get into, and often, if given sort of left to their own devices, they'll sleep through feeds, which can then cause issues with their ability to gain weight, their ability to stay hydrated, and their ability to keep their blood sugars up. So until they reach birth weight, we will have you usually wake the baby up After that, whether it be breastfeeding or bottle feeding, the schedule, and I hate that word schedule, but the routine will be on demand, meaning your new boss is over there in that, bassinet wearing the diapers, and whatever he or she says is what goes in terms of feeding. So when baby says it's time to eat, they're going to eat, even if that's every 30 minutes for a few hours, even if it's 4 or 5 hours, preferably overnight, that's okay, as long as baby's up to birth weight and feeding and growing well. But that typically takes a couple weeks. Next slide, please. All right, so peeing and pooping. You can't talk about feeding without peeing and pooping. Until you become a parent, you will have never been as obsessed as you will be now with taking pictures of poop, looking at poop, examining poop, showing others poop, bringing dirty diapers into our office to show us. Poop becomes the new obsession. And man, there's a lot of it. So eventually, at first, baby may make a pee or poo diaper, one pee or poo diaper in the first, let's say 24 hours. Then the next day, we're hoping for maybe 2 or 3 in 24 hours, and then 3 and 4. So each day we're hoping as baby gets better hydrated, there's more peeing and pooping. The promised land, the goal is that when we get up to hopefully day 4, 5, 6, every time baby eats, there's a wet and there's a poop, sometimes several per feed. The poop starts as a black, sticky, molasses looking thing called meconium. And it sort of transitions over time as baby gets new stuff going down the hatch. It gets to like a brown, it gets to a green. Eventually we're looking at like a stone ground mustard, yellow, chunky soup. There's pictures on the next slide. So if you're curious, I'll show you exactly what I mean. We will talk about the straining and grunting stuff that babies do a little bit later, but I'll talk about it here as well. There's a lot of drama with them passing poop. It looks pretty easy to do. It's soft. There's not a lot of it, but they sit there and grunt and strain all the time. And that's because their belly muscles aren't so strong. And it's hard to poop on your back. You should try it. In general, we don't worry about tons of poop. I get a lot of questions about, oh, my baby has diarrhea. Nope. It is expected 10 to 15 poops in 24 hours, and it's soup. It's mustard soup. We do worry if baby hasn't peed for more than about 12 hours, if there's blood in anything, whether it be the urine or the stool, or if after the stool has transitioned away from that black meconium, it goes back to the black color, or if it turns white. Those are 2 different but equally concerning situations. Next slide. I warned you. So right side of the screen is normal poop, and it's like chunky, hummusy, cream spinach kind of stuff, and that's all great, beautiful. And believe it or not, you'll have to trust me until you experience it. Those poops don't really smell so bad. The one on the left, if you can see it, it's got some streaks of blood, and that's more concerning. That can be a sign of, for example, an intolerance to dairy. Next slide. Jump scare again. So with all of that pooping can come diaper rash. Prior to being born, babies are floating in this beautiful amniotic chamber, right? Their skin is not dealing with the acidicness of urine, of stool. Now they come out to us and that skin is just being hit over and over again with peeing and pooping. It's really quite expected for that skin to start to break down. So this is the booty hole, I think, is what we have covered here. And you can kind of see like the skin, almost like the top layer of skin just comes off, almost like a burn. Get some good thick diaper cream, and you want to, I call it frosting the cupcake. That's how much you want to put on, really load it on. But having a good diaper cream, I've put some of my favorite brands here, is definitely something I want you to be prepared for. Baby having a diaper rash on their butt is not a reflection typically of like you have the wrong diapers or you have the wrong wipes or you're not doing a good job with changing. It's really just a reflection of that skin is not used to all this. Next slide. Okay, questions about what I've said so far?
I don't see anything yet.
Great. We can move on whenever you're ready.
Yeah, let's go. That's
Sure.
good.
All right. So like I mentioned, Dr. Latin and Ailey did a really extensive and fantastic review of sleep. So I'm really just going to touch on this briefly, but encourage you to take a peek at her presentation as well. In the first week or two, babies are deceivingly sleepy. They can sleep up to about 20 hours in a 24-hour period. So it feels like, "Ah, this is easy. Like, this is like a doll. This baby just sleeps." As we get to the second, third, fourth week, they do tend to become real babies, and they tend to spend a lot more time awake in between feedings. I don't mean hours typically, but up to 30 to 60 minutes in between all those feeds. But remember, they eat every 1 to 3 hours around the clock. Most important part of sleep is safety. You're going to hear us, you're going to hear the birthing hospital, you're going to hear anything you've ever read about infant sleep talk about being back to sleep. Babies should be in their own individual space. It's okay to be in the room with you, just not in the bed with you, but in your own individual space. A bassinet, a crib, a pack and play, something kind of flat, simple, boring, with no frills, no bumpers, no pillows, no stuffed animals, no nothing. Swaddle blanket is totally fine, but other than that, nothing else in the sleep space. Why do we care about this? What we are trying to prevent is sudden infant death syndrome, or SIDS. Horrible, terrible thing that we know that things like co-sleeping and being anywhere but on the baby's back to sleep can increase your risk of that condition. Babies spend the first couple of months not wanting to be put down. I am a big believer in the concept of the fourth trimester. This transition from womb to world is really hard, and they don't come out saying, okay, now you can just go ahead and lay me on my back by myself. They spent 9 months snuggled up in that little apartment of yours in there. It's 98.6 degrees. There's this constant heartbeat. There's movement. There's water. And now all of a sudden, we're going to put them on their back on a bassinet. And it is very common for babies basically to want to be held a lot. Those first few weeks, you're all in survival mode. So you do what your baby needs, and that's okay. You really can't spoil a baby in these first few weeks. You're not going to establish bad habits by holding your baby. Now, you're going to get really, really tired. So putting your baby down to sleep is, of course, important, but sometimes that's just not where your baby's going to want to be, and holding your baby is totally fine. Sometimes babies don't like a swaddle. I'm a big swaddle fan if the baby will take it. Again, creating that womb-like environment can be really important. Sometimes it's not that the baby doesn't like the swaddle, it's that they want their hands out. So it's totally fine to swaddle, for example, the lower half of the body. Baby still gets that nice squeeze and that nice cuddle, but hands are available for those who like to suck on their hands or put their thumbs in their mouth. A lot of my babies who love that, parents say, oh yeah, every ultrasound we ever got, we could never see their face because their hands were just up there. Why would they suddenly want to not do that? They've become accustomed to having their hands there. But swaddling can be a really helpful thing to kind of keep them contained and keep them soothed and keep them womb-ish. I've mentioned several times that this is hard and that babies are awake a lot and that it can be really tiring. I am a big proponent of having shifts. Now, for a breastfeeding mom, you may say, well, I can't take this shift off because I'm the one providing the milk. But for example, for bottle-fed babies, I do encourage parents to have shifts where a couple hours at a time, you're the person kind of doing the care while the other person can take a rest overnight. And frankly, that includes parents who are also working. I think it's important for everyone to pitch in with this. And this is temporary, but it's really important that, if possible, the burden of all of this care, especially overnight, not fall on one parent. So if you do not have a partner living in your home, using the services of a friend or a trusted family member, or hiring a trusted person is also encouraged. Next slide. All right, questions about sleep?
I still don't see any questions.
Okay. And let's move on. Okay, so busy slide. This is just for me to kind of remember all the things I want to talk about. Let's talk first about when you get to come see us. we will be meeting you and your baby, or wherever you choose to see your pediatrician, within about 1 to 3 days after discharge. So we give you about a day or two to get the hang of it at home. It's going to feel like the same visit over and over again the first few weeks because we see you pretty frequently. Again, we know baby's going to lose weight. We know that parents are getting the hang of all of this. And it's common for us to see babies at least once a week, if not more frequently. And that really depends on how things are going with weight, with how, peeing and pooping, with how's the bilirubin, which is a jaundice number. There's a lot of factors, and we make decisions as a team. When do we want to kind of meet up again to check in? What to bring? So the hospital is going to give you a lot of paperwork. It's going to feel like chapters of paperwork. If you can, bring that with you. We do get information from the hospital about your pregnancy history, your baby's delivery history, anything, lab tests. But honestly, sometimes that doesn't make it to us in time, or the information isn't complete. So if you do have paperwork the hospital has given you, just bring it all. We may not need it, but just please bring it to us. Obviously, bring your baby. Typically, people bring an extra set of diapers, tuck some wipes in there. I would bring an extra outfit. You never know when babies are going to pee and poop everywhere. And I would bring some backup feeding. If your baby is bottle fed, for example, I would bring an extra bottle with you. It depending on your level of experience and how many questions you have, and just a lot of different factors, I would plan to have you be with the pediatrician for about 30 to 40 minutes, if not longer. So having that available, knowing that babies may feed every hour, I think can be really, really helpful. Dr. O'Connor will be talking about fevers, but I'm going to also just plug, kind of fevers, or unplug them because I don't like them. Fevers are a really big deal in the first 4 weeks. They become less of a big deal when babies get their vaccines around 2 months, but honestly, in the first few months of life, fevers definitely make us as pediatricians nervous. The definition of a fever is 100.4 Fahrenheit or 38 Celsius or higher than that. And that's taken with a reliable thermometer. In newborn, in the case of an infant newborn, that's going to be a rectal thermometer. It is not accurate to do that goofy, like, temporal scanner thing, or to try and jam, a large ear thermometer into a newborn's ear. You're not going to get accurate measurements, because a true fever it's a hospitalization in the first few weeks. It's blood work. It can be urine testing. It can be a spinal tap. We want to get it right. And that's why it's going to be a rectal temp. If you call us, which you're always welcome to do, remember, we're always available. Our first question with newborns is, do they have a fever? So it is never wrong to check your baby's temperature. That being said, if things feel like they're going well, we don't, prescribe you to go ahead and check in on a regular basis. It's more like if you feel things are wrong, things are off, or your spidey sense is going off, that you'd like to check it. We will always support you making sure your baby doesn't have a fever. Let's talk about bats. So babies are going to be coming home with a what we call an umbilical stump, so dried up umbilical cord. And until that falls off, babies should not be given a bath under the water. So in other words, where the baby is submerged, where the belly button is going to get wet. Until that umbilical cord falls off, we would recommend sponge baths. So that's very simple. Laying the baby on a towel, using a soapy cloth with some gentle soap, and just toweling the baby off. Maybe once a week, twice a week. The really dirty part of the baby, the diaper area, that gets changed all the time. The rest of it, it's okay. The babies do not need to be bathed frequently. And in fact, their sensitive skin may not tolerate those frequent baths. So a couple times a week. Umbilical care. So I mentioned a little bit about this, and I do have some pictures coming up. It can take up to 4 weeks for the umbilical cord to fall off. When the baby's first born, it's like this white jelly tube thing, and it basically shrivels up. It's rotting flesh. So it shrivels up like an old crusty banana, and eventually it pops off. As that's happening, as that cord is separating from its base, there can be some bleeding, there can be some gooey goo, and it can be a little funky smelling. Once that's off, I'm usually fine with a true bath, meaning under the water, in about a day or two. Remember, you're going to come see us a lot, so we will be able to help you monitor the status of that umbilical cord. Baby fingernails are, like poop diapers, are an obsession for parents. Babies are poorly coordinated and spend a lot of time clawing at their faces and making werewolf scratch marks all over their faces. I don't know why they, well, I know why they do this. Their neurologic system's not mature, but it's not great. So I do encourage keeping nails short. The further you are to your due date or past your due date, babies come out with some crazy long nails. What we would encourage is for you to keep them trimmed. There's about 10 different ways to do this. The simplest and the one I would recommend is getting one of those baby nail clippers. I think I have a picture coming up of that. But you can file them. There's like fancy electrical things. This is not complicated. Basically, you just want to kind of clip off the edges of those nails. Even easier is purchasing the onesies that have the sleeves that fold over to keep baby's hands covered. I don't recommend things like mittens. They tend to just fall off and get lost everywhere. Fold over shirts, mittens, whatever, are not going to be great for babies who love to have their hands in their mouths or love to suck on their thumbs. That's going to be more tricky because they're going to get frustrated to not have access to that. So getting out of the house, I really encourage families, regardless of the season, to spend some time each day, if you're up for it, getting out of the house. That doesn't mean a grand trip all over the capital region. It means like a walk down your block. It means sitting on your front stoop or your deck or whatever you have. It means on a really hot afternoon, mall walking in a not crowded mall at a not crowded store. But it means sort of getting out of the house knowing that the earth is still spinning. Having a new baby can be really isolating. It can start to feel like the walls are closing in on you as you live this Groundhog's Day over and over again. So getting out there is really important. On really hot days, the first part of the day, the last part of the day, those are obviously going to be the best times to get out. But it's okay to get you and your baby out. Visitors. This is an always evolving question. During the height of the pandemic, this was a very, very hot topic. And I think if you line up 10 pediatricians, you're probably going to get 10 different answers in terms of their rules. What I want to say off the bat is no matter what, whatever rules you set as parents, which for me is way more important than what I say, but whatever rules you set as parents, you can blame us for that level of strictness, because there has been situations where families get a little put off by, oh, I can't visit the baby because I don't have this, or I know I'm sick, but I really want to visit my grandchild. The pediatrician said, no, we are totally fine to take the heat. My basic rules are I would like people to be well, and that includes, oh, I'm sniffly, I have allergies. Nope, I want people to be well. I would like people to be up to date with their basic vaccines, and I always do recommend a flu shot during flu season, which will be coming up around September. I recommend a Tdap, which is the tetanus pertussis, every 10 years. Pertussis is something we really do see and is out there in the community. So having that up to date every 10 years, I think is important. Children, and I say this as a mom, children are gross and they are vectors for ick. I'm not a big fan of certainly unwell children, but like little kids that kind of don't understand boundaries being all over being all over newborns. It's fine for them to visit. Do I want them holding the baby, kissing the baby? I don't. Now, the other side of this is if you all feel that right now is a time where you want to sort of hunker down and be a little family unit, that's okay too. It is okay to want that space to not have visitors at first. You set those boundaries for your family. If people are visiting, I mean this half snarky, there are no visitors, there's like helpers and workers. So please give people things to do. People don't want to just sit there and stare at the baby. They want to fold onesies. They want to wash bottles. They want to give you as parents a meal or make you drink a whole bunch of water or whatever. And then you decide from there what's comfortable for you. A word about postpartum mood issues. These are certainly more common in moms, and dads can also have postpartum mood concerns. But I'll just speak briefly about moms here. More common in women who have a prenatal history of any mental health issues. But that doesn't mean that you are going to have postpartum mood issues if you previously had any mental health issues. The reverse is also true. Those who may have never had any mental health issues, those things can come out after birth. Purely anecdotally, I've seen probably in the last 5 to 10 years a big rise, especially in postpartum anxiety. We do screenings of moms at the 1 month and 2 month checkups, and the OBs will also screen moms around, I think it's your 6-week follow-up. You know, I'm not going to touch on this for too long, but I will say, like, especially the anxiousness, the number one thing that I see that's increasing mom's anxiousness is social media. There is so much noise that you're hearing as a new parent. You're hearing from your family members. You've read a million books, and then you're on this social media. These algorithms are making you go down these rabbit holes that can be really scary. You're on, infant death talk. You're on my baby spitting up talk, and it's this swirling of anxiety that I think can be really hard to get out of. Just like your OB had you restrict, certain foods, certain beverages, I do encourage that moms and dads restrict their diet of social media after birth. It's a lot of downtime. It's a lot of late nights. It's a lot of just scrolling in the dark while you're feeding a baby. But I would encourage you to restrict that intake as much as you can, because it feels like no good comes of it sometimes. And that includes Google as well. Remember, we're here 24/7. Do have in your sort of not noise list people you trust, people who are moms, people who professionals. There's a few websites that I know Dr. Latin and Ailey talked about last time. The American Academy of Pediatrics has a fantastic sort of all-you-can-eat buffet of pediatric information called healthychildren.org, which I do encourage families to follow. So anyway, enough about that. Next slide. This is a baby taking a bath. Do not buy a fancy, super souped up bathtub. You just need a bucket, basically. Whether your baby is swaddled or covered, this is sort of a newfangled thing to have babies like dressed or covered. That's really up to you. I don't think medically it matters either way. Baths tend to be either a wonderful time for babies or terrible and they hate it and you're just trying to get it done as quickly as humanly possible. Next slide. Here's some rectal thermometers. This is where you play just the tip. So that silver tip is, you can cover it with like a little bit of Vaseline, and that part goes into the baby's rectum, and within about 5 seconds, you get a number. It's not as scary as it seems, but it's a worthwhile piece of equipment to have. Next slide. Belly button picture. So the one on the left is a fresh cord. That vertical plastic thing, that's not a piece of human. That is a thing the hospital provides. It's like a clamp to help the umbilical cord stop bleeding. And that should be taken off before baby leaves the hospital. We do have a way of taking those off if babies make it to our office with them, but that's plastic. And then the picture on the right is basically like shriveled up raisin umbilical cord stump, and that will come off. Next picture. These are nail clippers. I really like the clippy, that one I think is most successful. Next. All right, questions about what I've said? I know that was a lot.
We do have a question. How should we clean the umbilical cord until it falls off?
Yeah, so actually don't do anything with it. Back in the day, like 20 years ago when I started this pediatrician thing, we would like clean it with alcohol, and my grandma would probably still tell you to do that, but no, we don't do that anymore. You should just leave it alone until it comes off.
Do you have any feelings about parents biting off the nails of babies?
I have a lot of feelings about that. Yeah. So my worry, our mouths are gross. and lots of bacteria in our mouths. And there's so many other products you can use. So I don't encourage that because I worry that that will potentially introduce oral bacteria under baby's skin. And babies' immune systems in this young age, they're not so great. That's one of the reasons we are so neurotic about fevers. So no, I would not bite your baby's nails.
Okay, I don't see any other questions. I think we can proceed.
Okay. Okay, these are some weird things that you'll see. Again, Dr. O'Connor is going to go, I'm sure, into a lot more detail, but I'll hit on some of these things briefly. I think the next slide is a lot of rashes. So, and there's another one that I should have added that I'm going to talk about. The rash on the left. So in the first week, up to 2 weeks, babies can have this rash called erythema toxicum. Scary name, not a scary rash. We call it ETOX for short. Red pimples with like a red cloud around it. And they are migratory, meaning there's one here and then, oh, that one's gone. Now it's down here, it's up here. They kind of move all around in the first week. They're especially prominent after bath or snuggling, so heat. And they do go away. They don't leave any marks or anything, and they can be top to bottom, but scary for families. The middle baby is a baby demonstrating jaundice. So almost every baby has some degree of jaundice or yellowing of their skin. The babies who are the most jaundiced sort of have jaundice top to bottom. The babies who are the least jaundiced have it just in their face and eyes. And this can even take up to a month or longer to get rid of. Every baby has their bilirubin or the chemical that causes jaundice. Every baby has that checked in the hospital. And depending on that number, as well as some other factors, we sometimes will check that during our initial visits as well. The last one that you see here is a baby with peeling skin. Babies lose the top layer of skin that they had in utero. They like shed like a snake. So it is very common for babies to start to peel and have this like scaly skin. It can even crack around the wrists, around the ankles, around the armpits. You can certainly use like a thick moisturizer like Aquaphor or CeraVe or Vaseline. You don't have to, because that process is going to happen no matter what. The fourth rash that you're not going to see there, but I'm going to paint the picture, starts around the 3rd week and can cause some distress, and that's baby acne. It looks like acne. It looks like white heads on the baby's face, scalp, upper chest, and upper back. It's a hormone adjustment mediated rash that can make people worry about an allergic reaction or infection. It's not. It does go away, but it's very common and usually at its worst around 1 month. Questions about skin stuff? Okay, next slide. So let's talk boy and girl parts. So vaginas first. It is common for girl babies to have some discharge from the vagina. All babies basically live as though they are pregnant when they're in utero. They're experiencing pregnancy hormones, just like mom, because they're all sharing the same bloodstream. When they're born, those hormones drop. And that is why babies can grow little baby breasts. And that is why girl babies can get a little bit of discharge from the vagina. It can look like mucus, like a white mucus. It can be yellow, and it can even be bloody like a period. Freaky, I know. But in the first week, your baby can get their period. And then circumcision concerns. Most babies are circumcised during the newborn hospital stay, and it can take about 7 to 10 days for the circumcision to heal. It is common for the penis to look really wild at first. Kind of the head of the penis is swollen. It can look red, and there can be this yellow adherent tissue that looks like pus, although it's not, called granulation tissue. We will obviously, as part of our visits, monitor the healing of the circumcision. Questions about boy and girl parts?
No.
Next. All right, so I mentioned how happy and sleepy and babies can be in the first few weeks. By around week 3, babies start to definitely wake up a lot. They wake up physically, but also their gut really wakes up. In utero, babies are fed through the umbilical cord, so their gut doesn't have to do anything. It basically lies dormant. And they come out, and now we are jamming them full of milk. So that gut really starts to move, hence the constant pooping. And then constant farting is what's going to start to happen. You're going to hear babies' tummies gurgling all the time. They're going to be moving and writhing and always trying to pass gas, which can then also lead to fussiness. I mentioned earlier, it's hard to pass gas and pass poop, even if that poop is really soft and would seem to be easy. Belly muscles are not very strong. Their positioning doesn't allow them to pass easily. So they spend a lot of time in this perception of GI discomfort. It is, in general, a normal state of being, but can be really stressful for parents. I think I have some products on the next slide. So in addition to things like massaging the belly, making the legs go up and down, we call them bicycle kicks, where one leg is kind of pushed all the way out and one leg's up and they kind of go back and forth like this. Tummy time can also be helpful to get gas out. There are some products that are available over the counter. These brands mean nothing. It's just what I was like quickly able to Google image. So I don't have anything there's nothing special about these particular brands. They're easy to find, but probiotic on the left, gripe water in the middle, and simethicone or gas relief drops on the right. These work for some babies some of the time, but you're absolutely allowed and encouraged to try them if your baby's gas is to the point where it's interfering with everyone's quality of life. The baby farts, that doesn't mean you have to run and grab some gripe water, because that's it's all normal. We're talking about the babies who are inconsolably crying for hours at a time, where it's impacting their sleep, and it's impacting you as parents in a big way. So gas is normal. You got to find that line of when to actually treat it with anything. Next slide. Actually, I don't know. I want to make sure we talk about formula. And anyway, we'll get to that. Let's talk about spitting up just for a moment. Super, super common. The majority of babies are in that lovely category that we call the happy spitter. Those are babies that are spitting up, covered in vomit, but they are happy, well-fed, well-growing babies. Spitting up can look like clear. It can look like fresh milk. It can look curdled. If it's hit the stomach and sort of sat in the stomach and started its digestion process, it can look like cottage cheese. For most babies, it's not a painful thing. In fact, they like it. It's like relieving the pressure valve when they've eaten too much and sort of overfilled their little baby tummies. It can look like a lot. A teaspoon of spitting up can look like an ounce. So we'll often have parents say, he spit up his whole feed. And for most babies, that's not truly the case. There are some signs of concern that we are always on the lookout for. Certainly blood is never a good thing. A green color to the spit is never great. Or if it's truly shooting across the room, we call that projectile. Those can be signs of red flags. And then the other thing, obviously, if babies are not gaining well, not feeding well, things that we very routinely monitor, those can be signs of concern. Next slide. So we know that spitting up in general can be a normal thing, but that doesn't mean that you just have to deal with it. It helps to burp frequently. So at least every ½ ounce to an ounce for a bottle-fed baby, just to get some of that air out, or between breaths. So you would feed the baby at a breast, burp, and try the other side. One of the biggest triggers for spitting up is sort of that lack of gravity. So I consider baby stomach like an open cup. The valve that's supposed to keep it shut stinks. When babies are laid flat, the valve goes from here to the side and everything kind of spills. So having baby at an angle can help. All the way up may put too much pressure on the belly. All the way down helps it all spill out. So like that middle angle after feeding, even up to about an hour, can be helpful for babies who tend to do a lot of spitting up. Biggest thing for you is to stay calm, knowing that this is going to happen a lot. Stay calm, it happens, and it is typically a temporary thing that does get better. That being said, families sort of want to fix this as soon as possible. A few questions that we get, the biggest ones are, how can we change what the baby's taking in to try and fix this problem or not problem? There's too many formulas out there. There's so many choices. There's probably 3 times as many as when I started in my career. And I think that's a lot for parents, and I feel terribly for parents. But in general, this isn't necessarily going to be a formula thing, and a formula change may not solve this issue. That being said, for babies who are really not cutting it with those other things I talked about, like growing and feeding well, there are things like hypoallergenic formula. Costly, doesn't taste well so great, but can be really helpful. There's some lower lactose formulations. There are some formulas that are not made from cow's milk, like goat's milk formula is becoming very popular. Soy is also available. And then for babies who are mainly breast milk fed, there's some research to suggest that getting rid of dairy intake in mom's diet can be helpful. It can take a few weeks to start to see those changes, and cutting dairy in mom's diet can be difficult. But for babies that we feel really need, that this is a medically concerning level of spitting, those are some solutions. Questions about spitting?
Not about spitting, but we have a few other questions. Do you want me to do them now or at the end?
No, we can do it now. That's fine.
Okay. One question is, when is the ideal month of the baby to bring them to the stores that might be crowded?
I would like babies to stay pretty isolated until they get their 2-month vaccines. Once they get that, they at least have that first level of protection against the really serious diseases. So I would say after the 2 months.
Okay. And the next question is, when should I call the doctor versus when is something just normal newborn stuff?
That's actually Dr. O'Connor's entire talk. So I definitely want you to sign up for that. It's a loaded question for me to sort of quickly answer, but I will say, as a new parent, if you're not sure, give us a call. That's why we're here. Give us a call. What a lot of families do, knowing that every few days you're going to be coming into the pediatrician in that first week, is they just make a running list of questions. But when in doubt, give us a call. Anything else, Alexis?
That covers it.
Great. These are just some quick slides I put together. So you're not going to invite me to your baby shower. That's okay. But if you did, I never bring anything fun. I bring the baby stuff, like the medical equipment that no one thinks to buy. So I don't do the cute like dresses. I bring you butt paste. These are some items that I would want in my sort of new parent survival kit. I'm going to go through them top to bottom. Again, in general, the brands don't matter as much. I'll let you know when they do. But the top left is saline nasal spray. Babies are pretty congested at first. And saline, which is just salt water spray, can really be helpful in concert with the product next to it, which is a nose sucker. I'm a big Nose Frida fan. I get nothing from the Nose Frida company. I wish I had invented it because I think it's genius, but I really like a Nose Frida over the bulb suction. And those two things together can really help clear nasal passages. The third is Aquaphor. I love it. You can use it top to bottom. I want to put it on my pancakes in the morning. It's great. It's great for circumcision care. It's great for dry skin. It sort of has a million uses. So a big tub of Aquaphor is really helpful in that first year and beyond. Cetaphil, or another really gentle soap. CeraVe makes a gentle soap. Dove makes a gentle soap. Something that doesn't have fragrance, can be used top to bottom, I think is a great soap to have on hand. For families who think they're going to be formula feeding, having a formula pitcher is very helpful. You will realize after a while, this whole making the bottle every single time with the water and the scoops and the shaking and the mixing, it can get to be a lot. So if you're doing 10 bottles in a day, having it pre-made can really be helpful, and having a pitcher like that is a fantastic thing. I am not a Dreft person. Dreft is like a very well-known baby laundry detergent, it still has fragrance in it. We really do want fragrance-free stuff. I think it's a pain in the butt to wash baby stuff separate from grown-up stuff. So using like a Tide-free and all-free, something that has no dye, has no fragrance for everyone's clothes, just makes life easier. You're going to want to wash everybody. Baby spends so much time next to your clothes as well. Everyone should be just free, clear, and all together. Infant or children's Tylenol, by the way, they're exactly the same thing, but infant children's Tylenol, great thing to have on hand. The generic is acetaminophen. It's not something we want you to give to your baby in the first month or two. Remember, we talked about fevers. We don't want to mask fevers, but it's a good thing to have on hand. The first time we definitely want you to have it on hand is after those 2-month vaccines, in case you need it. So it's a good thing to have. We'll talk you through dosing and all of that. And then the last over-the-counter that I think is helpful forever is hydrocortisone. Hydrocortisone is a topical steroid. You may never need it, but I think we use it for so many things. So a great thing to have on hand. Next slide. These are some things that I think are not necessary, but are commonly given at baby showers. Top left is the DockATot. I do not recommend any of the, especially for sleep, any DockATot. It is fine as a lounger, like an awake baby lounger, but there are much more cheap, much more portable options like the Boppy lounger. None of it should be used for sleep, but please don't use a DockATot. Next is the diaper genie or any of the diaper pails. You're changing that baby's diaper all the time. It is not, in my opinion, worth it to have a pail that's just for dirty diapers. You end up having to deal with changing that thing. It's just another thing to change. So I don't think they're necessary. I mentioned a little about mittens. I'll say the same thing about socks. Those tend to get misplaced, mismatched. And in the end, they're adorable, but they are, I don't think, necessary. Bottom left is a spatula for applying cream to your baby's butt. You're going to be getting all up in your baby's business with your fingers, and the spatula is just another piece of equipment that is not necessary. Wipe warmers. Again, lots of diaper changes. Having to warm up those wipes every time, not necessary. Those wipes are room temperature. You're not keeping them in the refrigerator. Don't get that. The PPTP or any of those things that go over the baby's penis so you don't get peed on, that doesn't work. And being peed on is good luck. So don't get those. They end up just falling everywhere. And it's just another thing for you to wash. If you have a boy baby, you're going to get peed on, TP or no TP. And then the last, we're not talking about solid foods today because that's not till about 4 to 6 months, but I wouldn't at this point invest in an expensive baby food system. Baby food can be made with a lot of the things you probably already own and don't necessarily need anything special. And then I know there's like a billion other products that I would call middle of the road for me that I'm happy to talk about, but these are things I sort of see as like a don't and definitely. Questions about what I've said?
No questions.
All right, next slide. Okay, so we've come to the end of the road with our learning. Wanted to plug our website, which has a lot of really helpful information about Latham Pediatrics, including biographies about each of us as providers. We're all taking on new newborns and excited to meet you. So you can kind of look through and see, which providers resonate with you. Some policies, you can see photographs of our office to get a sense of sort of what things look like inside. There's registration forms, goes over insurance, kind of the housekeeping stuff is all there. So do check it out. And this presentation will also be pinned there under, I think under the news link. Next slide. You do not, if you're choosing to come work with us, which we'd be thrilled to welcome you, until your baby's born, there's nothing you need to do to register with us. We really need like a name and a date of birth. So wait to have your baby first. And then from the birthing hospital, the team there will talk you through setting up an appointment. And again, it's usually within about a 1 to 3 day after discharge time period. And remember that we are here on Saturdays as well. And we're happy to see newborns I welcomed a newborn yesterday morning. So there's availability for you regardless of what day you go home. Next slide. And then Sunday the 7th and Sunday the 28th are going to be, my colleagues will be reviewing additional topics. Dr. O'Connor will be going over kind of the gamut of stuff that's not normal versus stuff that's normal with babies. And a few of our pediatric nurse practitioners who have extensive experience working in the neonatal intensive care unit are going to be going over babies who are born early. So do register for those. I know that they're going to be really fantastic talks.